Mrs. Jones, my name is Madison. Can you give me your, I'm going to be your nurse today. Can you give me your name and date of birth? Okay. I'm going to check patient ID, ma'am. It's correct. I'm going to provide height and hygiene. And provide privacy. Is it alright if I do an assessment on you today? Okay. The first thing I'm going to do is check your pupils. They are 5. And then I'm going to see if your eyes constrict. Pupils constrict to a 4. And I'm going to test for rigidity of the eyes. Can I have you follow my pen line? Doing the 6 cardinal signs. Perfect. No rigidity noted. I will also test for accommodation. And it's present. Miss Jones, are you able to tell me the year? Provided correct year. Are you able to tell me what season we are in? Provided the correct season. The next thing I will do is test your upper extremity motor function. I'll have you squeeze my hands. Strength is equal. I'll have you press down. Perfect. Pull up. Perfect. +5. Motor function. I'll test that with the lower extremities. Miss Jones, can I have you push down on my hands? Perfect. Perfect. +5 motor function of the lower extremities. The next thing I will do is test for nuchal rigidity. Any pain? Nope. Okay. I will then assess patient's reflexes, starting with the tricep. I'll just have you relax really quick. Perfect. Reflex is present. Then we'll do the bicep. Bicep present. And we'll do the brachioradial. Present. I would also do that bilaterally. I will then have the patient sit up. There we go. And I will test the patellar. Miss Jones will just have you relax. Positive. Achilles tendon. Positive. And Miss Jones, I'm going to have a slight tickle your foot a little bit with the end of my tool. Babinski is negative. Miss Jones, is it alright if I do a respiratory assessment on you? We're going to expose the chest a little bit. Here I would note her breathing rate pattern. I would also look for chest expansion and making sure that there's no lesions, skin is dry and intact, no bruising and scarring. I then would listen. Miss Jones, can you have you take a deep breath, please? In and out each time I move my stethoscope. Perfect. Lung sounds are clear. 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 then help you to your side so I can listen to your back. I'll have you take the same deep breaths each time I move my stethoscope again. Clear, 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 and clear. I am now just going to percuss on your back. Noting Renaissance, which is a normal finding. Renaissance was heard. I will then have the patient come back, and if there were any adventitious sounds, I would listen for egophony and perform tactical phremesis. Ms. Jones, is it alright if we expose the chest again so I can listen to your heart? Okay, here I would look for, make sure that the trachea is midline, looking for any discoloration again with the chest, any bruising. I would also see any palpitations or anything like that. The first thing I will do is auscultate. I will find the suprasternal notch down to the angle Lewis to the right side, second intercostal space. Here is the aortic valve. Regular rate and rhythm. S1 and S2 are present. On the opposite side, on the left side, is the pulmonic valve, second intercostal space. Regular rhythm, S1 and S2 are heard. Third intercostal space, Erb's point. Regular rhythm, S1 and S2 are present. Fourth intercostal space, tricuspid. Regular rhythm, S1 and S2 are present. Fifth intercostal space, mid-clavicular line, is the apical or the mitral valve. Regular rhythm, S1 and S2 are present. Here's the apical pulse. So I would listen there for a full minute to get the apical pulse. I would also check for enlargement of the heart by pressing down and feeling that pulsation. It can be easier if you turn them to the left side. The next thing I will do is check pulsations. I'll start at the temporal, +2. I will then check jugular vein distension with the head of the bed up to 45-degree angle. I will look for any distension there, and there is no distension. I will then listen by using the bell of my stethoscope. I'll have you take a deep breath in and hold it. No bruit noted. I then will assess the carotid artery, +2 bilateral. Then the brachial, radial, ulnar, which are +2 bilaterally. I'll then check cap refill, less than 3 seconds. Less than 3 seconds. Ms. Jones, I gotta expose you a little bit to check your femoral pulse. +2 bilateral. And then we'll check your popliteal. +2. +2 bilaterally. And then I'll check your dorsal pedis. +2 bilaterally. And your posterior tibial. plus 2 bilaterally. Here I would check cap refill, less than 3 seconds. I would also note any discoloration of the skin for any noted arterial or venous disease. The skin is clean, dry, and intact with warm. There is no cold, it's not hot. There's no redness or brown skin. There is also no ulcers or formation of any on the ankles. I would also check the upper extremities for any edema as well as the lower. There is none noted. And then, Ms. Jones, is it all right if we expose your abdomen? I'm going to put the head of the bed down. And place your feet up a little bit. Ms. Jones, could I have you cough, looking for any hernias or distension? I would also examine the stomach for symmetry. It is flat. I would also look for any discoloration, scarring, any pulsations. I would also ask the patient if they need to empty their bladder before I perform this, or ask them if they're having any pain. If they're not having any pain, then we'll continue. First thing I'll do is auscultate. I will start in the right lower quadrant. Noting active bowel sounds. Active bowel sounds throughout all quadrants. Then I will do light palpation. So, Ms. Jones, can you tell me if you're having any discomfort? I would be watching the patient's face for any discomfort or any sign of distress or tenderness. And then I would percuss. Jarvis does not recommend us percussing, only for advanced practice, but for this demonstration I will. Noting tympany throughout. There could be some dullness in the upper right quadrant due to the liver. I also would assess for appendicitis if this patient had it. I would locate the Murphy's point and press down on the left lower quadrant, or left lower quadrant, pressing down for any rebound tenderness and pain in the right lower quadrant. I also could perform lifting the leg and noting any pain while lifting in the right lower quadrant. I would make sure that the patient is comfortable and put the head of the bed up. I would make sure that the patient's collar is within reach, the bed is in the lowest position, perform hand hygiene, and I also would check for clubbing of the fingers to make sure that there's no sign of arterial or heart deficiency or anything like that. I also would perform on a lung assessment. I would percuss on the front side of the chest. Jarvis does not recommend that, so I didn't for this assessment, but I would in a normal situation if possible. This completes my assessment.